Hello, my name is Luz Giraldo, and I am a friend and patient of Dr. Farr Nezhat. I would like to share my experience with endometriosis with you all, but first, I would like to tell you that if you're in pain, if you have excessive bleeding, if you have nausea and vomiting with your cramps, if you're experiencing fainting spells because the pain is so severe, that is not normal. And I'd like to urge you to be your own advocate. You need to find a gynecologist who specializes in endometriosis, like Dr. Nezhat, to get these issues addressed immediately. My endometriosis started slowly and silently. It all began the morning of my senior year when I was getting ready to cheer for my high school homecoming football game. I had cramps and it was so severe, I passed out. As quickly as the fainting episode came on, that's how fast it disappeared. This went on into my late teens and 20s, and even into my 30s. When I went to go see an OBGYN early on, they told me what I'm sure many of you hear. It's normal. You'll grow out of it. Take Motrin. Use a heating pad. Never was I ever referred to a gynecologist that specialized in endometriosis. I was never sent to get a transvaginal ultrasound, never talk of seeing a specialist, and I went on like this in my 20s and 30s. Well, lucky for me, I was a surgical rep in the operating room in New York City, and that's when I met Dr. Farr Nezhat. I was able to work with Dr. Nezhat and see Dr. Nezhat perform thousands of robotic cases on endometriosis patients. I was able to learn about endometriosis and all the symptoms, and I began to wonder, do I have endometriosis? Am I a candidate for surgery? I started to wonder because as I got older, the bleeding got worse, the cramping was worse, the fainting spells began to come on more frequently. So my husband finally said to me, I think it's time you see Dr. Nezhat. I continued to have frequent fainting spells from the pain. So I had to decide to be brave and go see Dr. Nezhat, and Dr. Nezhat was able to diagnose my endometriosis. Before I had the surgery, I went on to do IVF to attempt to get viable embryos, and because the endometriosis was so severe, we were only able to get one. That being said, I waited way too long to have surgery. This past summer, I flew up to New York from Florida and I got robotic surgery at NYU Winthrop Hospital with Dr. Nezhat. I had stage 4 endometriosis lesions on my ovaries, my uterus, my fallopian tubes, in the rectal vaginal space, and even on my ureter. Had I been more proactive, we probably would have been able to address this at an earlier stage. Luckily, I am now in full recovery. I am feeling great. The mysterious upper back pain that I had is now gone. Most people think endometriosis only affects your lower back. Well, endometriosis can also hurt your upper back and your shoulder as well. So that being said, ladies, please do not be afraid. Find a gynecologist who specializes in endometriosis like Dr. Nezhat. And if something doesn't feel right, do not give up on finding answers for yourself. I wish you all the best, and I wish you a pain-free life. Thank you.